Welcome to Community Health Nursing mini-series. This mini-series have been designed to introduce to you fundamental community public health nursing concepts. Before you begin listening to this mini-series, I recommend that you have your notebook ready and you have your PowerPoint printed and that you're taking notes so you can follow along with this mini-series lesson. By the end of this lesson, the student will describe the role of stakeholders in public health, will understand determinants of public health, will review online resources for relevant international, national, state, and local public health agencies. Let's think about this. What determines the health of a population? Is it genes and biology? Is it behaviors? Is it medical care, or is it social or societal characteristics in our environment? Notice that medical care represents about a quarter portion of the chart. We spend trillions of dollars on healthcare, and yet it only determines about 25% of our health. The remaining 75% of what determines our health as a population is our total environment and what goes on, our social environment in which we live, plus our health behaviors, and to a lesser extent, our genes and our biology. It is then important that as we intervene for populations or even individuals, we look at societal and social characteristics in the environment and see how those impact their health and well-being. When we talk about key stakeholders in public health, there's a lot of private organizations, but there's also a lot of non-governmental organizations. But what comes to mind is the World Health Organizations and the United Nations. I have provided links to both in your lecture series online. Click on the links that are provided online and learn how these organizations influence public health. Let us now stop and pause the video and take a moment to research what are the top 10 leading causes of death in our world today. Make sure you write these down and make sure you get to know them. In the United States, we have the Department of Health and Human Services on a national level that is organized to meet the health and welfare needs of and the well-being of Americans. I have provided a link in your notes for you to be able to learn more about the Department of Health and Human Services. Pause the video and explore with that link. Did you have fun exploring? I assigned you to come to this website and look a little bit about the Department of Health and Human Services to see what they govern and how they look out for the welfare of people in the United States. Under the HHS agencies, there's a lot of offices. There's Administration of Children and Families, and I encourage you to look at that. Administration of Community Living. We also have the Agency for Healthcare Research and Quality. We have the Agency for Toxic Substances and Disease Registry. We have ASA, ASA, ASFR. We have ASH. We have ASL. We have ASPE, ASPR, ASPA. And the CDC falls under the agency, so you can also explore the CDC. The Centers for Medicare and Medicaid are also part of that. We have the Departmental Appeals Board that and the Food and Drug Administration, the Health Resource and Services Administration, the Indian Health Services, the National Institute of Health, the Office of Civil Rights, Office of Global Affairs, the Office of the Inspector General, Office of Intergovernmental and External Affairs. There's a lot of offices that are part of the Department of Health and Human Services that you should be, as a nurse, be familiar with how that's governed. Let us take now time to pause and explore the top 10 leading causes of death in the United States. Make sure you write those down. On the state level, because we live in Missouri, we're going to discuss the Missouri Department of Health and Senior Services, and I've included a link. State health departments vary widely, and they're directed by the health commissioner or the secretary of health that's appointed by the governor for each state. Who leads our state health department? That's a good question. Go ahead and explore that and find out what it takes to lead our state health department by following the link that I've provided online. What are the top 10 leading causes of death in Missouri? Go ahead and pause the button and also explore those. And you can restart the lecture after you've written those down. Moving in to the local health departments, the services and programs vary widely, even in the state of Missouri alone. Usually, the local health departments are directed by a health officer or an administrator that's appointed by local leadership. They have direct responsibility to the citizens in a community. For us here in Springfield, we have the Springfield Greene County Health Department. I've provided you a link, and I would like for you to explore your local health department. I've also included other health departments that surround Springfield, Missouri. What do local health departments do? They monitor communicable diseases. They monitor the incidence and prevalence. They prevent illnesses and promote health. They do TB screenings. They do lead poisoning interventions. They do immunizations. They do STD screenings. They do inspections for restaurants, and they do water supply, educational programs. They do direct care for sick people. They also do prenatal care and well child care. They provide direct care for people living in rural, isolated areas and those with low income. Let us now pause this video once again and explore what are the top 10 leading causes of death in my county. So whatever county you live in, try to figure out what are the top 10 leading causes of death in your county. At this point, you have the 10 leading causes of death in the nation, in the world, in your state, and in your county. And you've written all those down. Look at them and see how they compare. There are many other partners that come alongside the public health arena to work with us and make sure that populations are healthy. Employers and businesses, media, government agencies, non-governmental agencies, academia, we all work with a team of stakeholders that look out for public health.